Hi, COMI family, and today we are here with another live COMI talk show, and we are reporting from IPSC Spinal and Back Pain Hospital, and we are here to welcome Dr. Pankaj Suranj. Hi, Dr. Pankaj Suranj.
Hi.
Welcome to the COMI talk show.
Thank you.
I'll just read some lines about Dr. Pankaj, about him. So, Dr. Pankaj has a bachelor's degree in medicine and surgery and has a master in anesthesiology. I hope I read it correctly. He is one of the few to be qualified FIPP, that's a Fellow Interventional Pain Practice from Budapest and Hungary, and is certified in International Spine and Pain from the World Institute of Pain USA. He is accredited to many pain societies, both nationally and internationally, and is a member and fellow of them. He is the chairperson of the World Institute Pain India chapter and the director of Spine Interventions and Interventional Pain Management management courses, IPSC India. He has been recently appointed as an academic head from Voices International University for conducting courses in pain management. He has been privileged to host the biggest international pain conference, ICIPM 2012, at the All India Institute of Medical Sciences, AIMS, New Delhi, India. Oh man, that's really, really cool. So nice to hear that we have someone in our circle who is dealing in pain. Because pain is something, we all have been facing, whether it's a neck pain, leg pain. Well, I don't know why.
The most common symptom patient present is the pain. The doctor.
I know. And when I got this, knowing about you, I thought that I have to meet you, because this is something that we all are facing. Maybe due to our, the posture we are using, or, I don't know, due to the shoes, due to the weather, food. So I thought that why don't we meet you and, listen to you.
Yeah.
So what is the reason, because I think we all are eating, I don't know, we say healthy. But I don't know how healthy it is, So you have to let us know that what are the main reasons that we all are suffering for some other pain, and at a very early age. Because we used to hear that our grannies and all are having pain at this age. But at our age, and maybe in a very young age also, like 20s also, people have started developing these kind of pains.
True, and that is, I think, for the medical fraternity, we've seen that this is the most threatening situation for us, for the country actually.
Yes.
If you talk about the population, around 30% of population, they are suffering from pain.
That's
worldwide.
Yes.
And you know that there is a recent data from the WHO which says that by 2030, this will be the major leading cause of morbidity.
Cause of pain.
Yeah, by 2030, and worldwide. So that is the kind of prevalence what we have, and the incidence has been increasing. So that is actually very much worrisome.
Alarming, yeah.
Very alarming, and the most alarming thing is, like as you said, grannies, they are suffering from they are in 70s, 80s, they are suffering from the joint pain. We expect that. With the
That's normal, with the age is normal.
Yes. We know. But now we are seeing people in 20s, 30s.
Yes, that's a cause of worry.
Yeah. So I've been treating like almost every month. I'm doing endoscopic surgery on the spine patient. They are in less than 20 years. Every month I'm getting such patients. So we never saw.
So what is the reason, Doctor Sir? What is the why this is happening at this early age?
So as you said, these are lifestyle diseases. Food and everything, these matters with the cardiovascular disease, right? Hypertension, diabetes. There you have a lot of role of the food. When you're not keeping a proper diet, then you have these kind of morbidities. But when we talk about the chronic pains, especially the joint pains and the spine pain, the most common reason is our sitting habits.
Postures,
Posture, just sitting. Now you know that we have a habit of sitting for 8 to 10 hours.
Yes.
We are just stick to the computers and laptops and mobiles.
Yes.
Right? Almost 8 to 10 hours, and especially in cities like Delhi and metro cities, we have a driving of 2 to 3 hours. Right? So almost 10 to 12 hours of your
sitting job.
You're sitting. That's it. And rest of the time, maybe you are sleeping or you are back home, you are watching TV, and that too again lying down on the sofa and bad posture. So that is the main reason why we are suffering a lot of back issues.
That's why the youngsters are, mostly
Youngsters
because
are getting-
mostly they are using the digital, the
Absolutely.
media is there and phone is there, laptop is there, and they're so
Yes.
glued to it
Yes.
that
The simple reason. Technically, I'm told to talk about the technical reason.
But why, I'm not seeing too much, talk about this, because we know the problem many are facing.
Yes.
But still there is nothing, I don't see something going very viral, something from the doctor perspective, from the, that should be there, that awareness or something kind of, because this is not happening what I see.
Yeah, maybe there you have a role. There the media has a role, definitely, when the media comes and when they pick up such issues. Because till the time it goes to the alarming level, usually we don't see and we don't start seeing that.
We ignore it.
Right? We try to ignore that. Even if we say there's diabetes, hypertension, it was there since last many years.
Yes.
But now since it has gone to the such level that we are getting a sudden cardiac arrest happening.
Yes.
Now the attention is there, the media attention is there.
Yes.
So similarly for the pain also. And especially in India. In India, the pain is considered as like maybe you have done something wrong in your past, that's why you are suffering of pain, right?
Mm-hmm.
I am having pain, it's okay, I can control it, I can go to physiotherapist, I can go to some Baba Shaka type and right? I can take this pill, that pill, I will take other things, right? So we try a lot of things, till the time it goes worse.
Right.
So that is the reason why people.
I think physiotherapy also have increased a lot, because I have seen it's mushrooming every place. There's a lot of physiotherapists.
But yes, definitely we need to understand that also, because physiotherapy is a supportive treatment, definitely. But what we must convey to the general public is that you must see your doctor first. When you talk about a chronic pain, if it is not subsiding in 7 days, 10 days, you must see the doctor first. So doctor understands the inside, what is happening inside. Okay? And then if they suggest you go for the physiotherapy, then it is okay.
Here I'd like to ask one question for you. What happened many a time, there's a lot of pain, like maybe neck pain or some other pain is there, and everybody says let's go to the physiotherapist. And they started the medicines, and they also started the exercises. So what do you say? We should just start following him, or we should first go to the doctor, the spinal doctor?
That is most important.
Yes.
That is most important, because if you talk about it, just I take an example like neck pain.
Yes.
Right? In the neck you have joints, you have muscles, you have ligaments, you have bone, you have nerves, right? There are multiple things which are there which may cause generate pain. Right? So neck pain is not just neck pain.
Right.
Neck pain may be cervical facet arthropathy, maybe it's a tendinopathy, maybe bone issue, maybe compression fracture. There's so many diagnoses are there.
Right.
So first hit for treatment, when we say treatment, right? Treatment comes when we have a diagnosis.
Right.
So pain is not a diagnosis. Pain is a symptom
of
any disease.
Not right. Yes.
Something is happening wrong inside the body.
Yes.
So body is signaling you that something is wrong there.
Right.
So it's a signal.
Right.
So pain is not a diagnosis. So we are not treating just pain. We are treating the cause.
Right.
For that we must know the cause. What is the reason for that?
So you said that first one should go to the doctor.
Yes.
And
they must visit the doctor.
And then go to the
And then make a
physiotherapist.
diagnosis. Yes, this patient is fit for the physiotherapy or not. At times there are conditions where we need urgent attention, where we may have to go urgent surgery also. Okay, so that diagnosis doctor can make.
But I think you don't feel that the physiotherapist should, because I also facing this problem because I have been using social media very extensively.
Yeah, I know.
Very, very extensively. So, but I go to my therapist and the physiotherapist, and they like straight away give me, right now also I'm feeling that pain in my neck. So they just treat me and they give me some therapies and I go on it. But they never suggested me to, go to a doctor, paying doctor. So that is not right.
At certain stage, as I mentioned, that if it is not helping, obviously they should refer to the doctor. So the doctor can make a proper diagnosis and then they can treat accordingly.
Okay.
Yes, definitely as a doctor also, when we see that there's not much issue, it's just a muscular sprain or
then you will suggest go to therapist
we
and
will also suggest them to go to the therapist and come back to us.
Right.
And then we can see that if everything is fine.
So, Doctor, can you just tell me about this hospital, IPSC, something about what all services, facilities are here?
Yeah.
So, this is in Dwarka, and so let us know at what all we personally look forward here.
Yeah. So IPSC is a unique concept which I have come up with. Pain medicine as such is a new specialty for India.
Pain medicine.
Pain medicine.
Okay.
The pain medicine is a relatively new. It's a relatively new because this specialty has been there in US and other countries, in Western countries since maybe 40-50 years now.
Okay.
For India, it's like a relatively new. Like since last 15 years, we are practicing this pain medicine. The one good advantage thing which has happened in India, that it has got a super specialty status. That means once you do MBBS, then you go for your specialization, and then after that you can go for the super specialty in pain medicine.
Okay.
So that's super specialty status we have received in India. So
Wow.
India is the first country to get a super specialty status for pain medicine.
Wow.
Yes.
That's an achievement.
That's a big achievement. Yes. So this hospital basically, I started practicing way back in 2010 about the pain medicine. That time obviously it was not there, so I went out to learn all the techniques, and then I came to India and then I started practicing pain in 2010. 2012 I started my small setup because that time the concept was new, so awareness was not there. 2020 till 20 I was running a small daycare setup. Then I decided that because the practice also started growing, awareness started increasing, people started recognizing the specialty. So then we opened this hospital, and this is the first hospital in India, in fact, for that matter, in the Asia, which is a pain specialty hospital.
Wow, this is, I think, I didn't know this.
Yes.
So it's nice, because I didn't research, sorry. But this is really nice to hear.
This is the first hospital.
And I'm proud and I'm sitting with you.
Thank you so much.
That is really nice.
So the concept of this hospital is that we are doing step ladder approach. So any patient who comes to us with a pain, so we have the facility of physiotherapy, we have rehabilitation facility, we have intervention, that is minimally invasive techniques, we have surgical interventions. So all these facilities are available inside this hospital. So any patient who comes to us with a knee pain, joint pain or chronic pain, we have a team of the doctors who decide what patient requires. At what stage patient comes, accordingly we decide. So it's not that patient, I'm only doing endoscopy, so patient comes to me, I'll say that let's go for the endoscopy. No, it's not that. If the patient needs surgery, I'll take the help of my neurosurgeon or spine surgeon, we'll do surgery. If the patient just requires physiotherapy, we have a physiotherapy department available, we send them for the physiotherapy.
Okay.
So we are doing the step ladder approach. If the physiotherapy is not helping, then it goes to the intervention. So this is the kind of concept.
There's lot of steps there.
Yes. So
there's something called minimally invasive techniques.
Yes.
So can you just let us know what are these?
So our main focus on the IPSC, IPSC also stands for the International Pain and Spine Hospital.
Okay.
So interventions are the minimally invasive techniques.
Right.
Okay, so minimally invasive techniques, I'll just tell you about with the example. Let me give you some example.
Yeah.
So that the common examples like you all must have heard about the angioplasty.
Yeah.
Everybody knows about that, right?
Yeah.
Okay. So 3 decades back, what was there for the heart attack? There was only option was the open bypass surgery.
Open heart surgery.
Open bypass surgery. That was the only option, right? Now what is happening? 95% of the cases we can open with a small hole.
Yes.
We can do angioplasties.
Yes.
We can put a stent. We can open blocks, right?
Yes.
So this is called intervention cardiology.
Okay.
So same for the spine and the joints, we have intervention pain.
Wow. You explained it beautifully. You know?
So this is a perfect example to explain because everybody has seen this.
Right.
So now for the spine, let's say for the spine.
Yes.
Now for spine, if you have a disc prolapse, split disc, right?
Yes.
Till 10 years back, what was there? Open surgery.
Yes.
Either you take rest for 3 months, 6 months,
Right.
keep doing physiotherapy, keep taking pills,
Right.
right? Nothing happens, go for surgery.
Right.
But now we don't have to wait. If the patient is not responding to the physiotherapy or medicines, in 7 days we can take a decision. We can just go with a small hole and we can remove that part of the disc without disturbing the entire spine.
Wow.
We don't have to cut the muscles, we don't have to cut the ligaments, we don't have to cut the bones, we don't have to touch the nerves, and we can see everything with a small hole, and we don't have to put the patient on general anesthesia also.
Okay.
Everything is done under local anesthesia.
Achha.
So patient also can see there what is happening inside the spine. Same for the fractures. We know about the osteoporosis, right? Osteoporosis.
Yes.
Very common.
Very common.
Very common in the old ages.
So,
in 70s,
yeah, I want to
80s.
understand because for my mom also, she's also facing it. So, what is there any cure?
So cure is definitely for the osteoporosis. We have a cure of the medical management. We have to put them on the bismuth, some bone preserving medications. Calcium D3 is one of the supplements what we can use. There are some calcitonin, some other medications are there, with which we can prevent osteoporosis. We can halt the osteoporosis progression. That we can do with the medical management.
Okay, but at an age of like 70, 75,
Yes.
if already it's reached to a stage, so what are the options we have?
So, medical management is definitely one thing, but at times what happens is sudden jerk, even sneeze,
Yes.
even small fall somewhere,
Yes.
that may cause a fracture of the spine.
Okay.
Right? Now these patients who are in the old ages, 70s, 80s, right? They have a fracture. Obviously we cannot send them for the bed rest. If you just put them on bed rest for 1 month or 2 months, they develop other issues.
Right.
The muscles goes into total wasting, right? They go more into osteoporosis because movement is not there. The joints get stiff,
Right.
right? We want them to be as mobile as soon as possible, right? So for that, what we can do, we can just go with a small board and we can fix it inside. We don't have to wait for 3 months, 2 months, 1 month or bed rest.
But just like this therapy, like minimal therapy, is working for you applied for the 70, that age also, or for early ages? So it's working.
I did. I'll give perfect example. I did this procedure, vertebroplasty procedure, the spine fixation procedure on my own grandfather.
Okay.
He was 97 that time.
Oh my God. That's
He
amazing.
died at the age of exactly after completing his 100.
100.
Yeah.
Lucky.
And I did this at the age of 87.
That's perfect.
So basically, this is the problem of the old age. Usually, we see this session in the
But I'm really happy to see the advanced technology,
Yes.
all those techniques and therapies. Because we already knew that this physiotherapy is there, but we didn't know that this kind of services is there. Yes, this is there, and where people can get it treated at that extent.
Yes.
I think amazing. I think we should spread it all over India.
Yeah, we have plans. We have plans to expand our operations in other parts. So we have opened one other hospital in Bangalore also.
Achha.
Yeah. So we have now 2.
You have Bangalore also.
We have
Okay,
Bangalore.
okay, that's nice.
And now we have for the 23-24 we have plans to open another 5 hospitals.
Wow,
That
that's
is
amazing record. Okay, so now next thing is that what are the myths, which many of us have, that do's and don'ts, I would say. मतलब जैसे ये नहीं करो, सुनते आ रहे हैं बड़ों से हम लोग ये कर रहे हैं. So in your field, I would like to understand that obviously patient must be coming to you every day and you must be like ये treat कर दो, oil लगा दो, ये कर दो, वो कर दो. जैसे आपने कहा झाड़ फूक भी होता है. So what are the main point that you feel that people come with you with this myth?
So the biggest myth is that pain is there to suffer. That is the biggest myth.
Okay.
Right?
या मतलब इवन हो गया तो शायद ठीक नहीं हो सकता.
हमारी मेंटालिटी बनी हुई है कि हमको पेन हो रहा है, चलो ठीक है, सहना है इसको.
राइट.
हमको दर्द हो रहा है तो उसको सहना है. अगर जॉइंट में दर्द है तो सहना है इसको.
राइट. इसका कोई सोल्यूशन नहीं है.
That is the biggest myth.
Biggest myth.
Right? Second biggest myth is for every pain there is a surgery. Biggest myth. No.
Oh, अच्छा.
हर दर्द का सर्जरी इलाज नहीं है. We have other techniques also. So maybe it's a myth or maybe you can say that it is awareness is not there, right? Third, few of the myths which are there, like हम बोलते हैं बहुत सालों से सुनते आ रहे हैं, है ना, सुनते आ रहे हैं, चला आ रहा है.
हाँ बिल्कुल
होता है. Like simple बैक पेन हुआ तो बोलते हैं कि नीचे जमीन पर सो जाओ.
That is so true.
बोलते हैं ना, बहुत पेशेंट आते हैं, वापस आते हैं कि मैं तो पिछले 15 दिन से बैठ के वो नीचे सो रहा हूँ.
चटाई करके सो रहा हूँ.
Why you doing this? अभी पता है कि हम बैक पेन हुआ तो सो जाओ नीचे. So that is again a big myth.
देखिए वो एक्चुअली क्या होता है ना कि हम सब डॉक्टर्स होते हैं.
So होता क्या था, ये तब का myth है जब हम 40 साल पहले, 30 साल पहले, when we used to use the cots, नायलॉन के होते थे उस टाइप के ना, so वो नीचे झुक जाते थे.
Right. Right.
अब हम कोई यूज करता है क्या वो चीज? We are not using that.
Yes.
Right? We don't use that.
Right.
Maybe in the villages you see there's kind of cots.
Right.
But अब कौन यूज करता है?
Right.
वो उस टाइम के लिए था कि आप उसके लिए आपको स्ट्रेट चाहिए,
Right.
क्योंकि आपको जैसे झुक जाता है तो आपको पूरी स्पाइन पूरी रात भर
और अच्छा उसके
झुकी
अंदर वो
रहती है।
खाट टाइप कुछ होता था
खाट type
उसपे,
वाला, हाँ।
हाँ वो कंफर्टेबल नहीं होता था वो।
तो उसके लिए बोलते थे कि तब आप बोलते थे कि
जेल में
आपको
हो
बैक
जाओ।
पेन हो गया तो नीचे
Flats हो जाओ।
फ्लैट्स हो जाओ, वो उस टाइम की बात थी।
Right.
अब इट्स नॉट एप्लीकेबल नाउ,
I know.
राइट?
Right.
सेम फॉर द
एक्चुअली कोई होता नहीं है नहीं बताने के लिए कि नहीं अब सही, अब लोग डॉक्टर के पास हम जाते नहीं है सारे, जल्दी से पेन हो रहा है चलो ठीक है ऑयल लगा लिया सब ठीक हो गया, सो गाइड कौन करेगा फिर? वो बात है।
सेम बैक पेन के लिए
Right.
बिगेस्ट मिथ हम बहुत सुनते हैं, हर पेशेंट को आके बताता है
हम्म।
गर्दन में दर्द हुआ, ठीक है क्या कर रहे हो? मैंने पिलो हटा दी,
कोई लगा दिया वॉल नहीं लगा ली।
पिलो हटा दिया।
हाँ।
अगेन बिग मिथ, नाउ जस्ट ट्राई इट योरसेल्फ। आप पिलो हटा के देखो, इफ यू आर यूजिंग पिलो फॉर इयर्स, if you remove the pillow, right, your neck is always in a strain
Okay.
because it is not maintaining that curvature.
Okay.
Right, with age also you have some fat deposition here. Right?
Okay.
फिर आपकी neck पूरी रात ऐसी लटकी हुई है. If you are taking a side turn, your neck is like this whole night.
Okay.
Okay, so you have to maintain that curvature. That's why pillow is important. Now, if you have a neck pain and if you start doing these stunts, what will happen? It will go into chronicity.
ये तो मैं भी करती।
वो और बढ़ता है तकलीफ,
अच्छा okay.
वो तकलीफ और बढ़ जाती है।
But I'll ask one more thing that pillow मतलब define करना चाहिए मतलब soft है या hard है मतलब depending upon this cervical किसी को हो रहा है this change होता है उसमें।
सर्वाइकल पिलोज आते हैं बट उसमें भी ना थोड़ा टाइम लगता है, टेस्ट लिटिल टाइम फॉर यू टू एडजस्ट। सो व्हाट वी नॉर्मली सजेस्ट इज इफ यू हैव अ नेक पेन, इफ यू हैव सम इश्यूज, you go to doctor. If there are some conditions where we ask the patient to not to use pillow,
हाँ जी।
or to take some different position.
Okay.
Okay, but not in all the cases. Maybe in 5% cases you may have to avoid pillow, or you have to take a certain different position.
Okay.
But what we suggest is that whatever pillow you are using, continue with that because you are used to, your body
Used to it.
used to have that kind of pillow. Right?
Okay.
So continue with that. Don't remove your pillows or don't add anything new. Once you are settled, then you can go for the trial of this cervical pillow because it takes time for you to adjust. It may take 4 to 6 weeks also, at times months also.
Okay.
Yeah. It's not that you start wearing today and you are happy tomorrow. Right? When you wear like हमको ये glasses, it takes time for you to adjust.
Obviously it takes time. Right.
So there are multiple such myths are there. The biggest I think is कि pain है जो चले ही उसको. No, it's not. That. We have lot
मतलब
of
cure है, treatment है, मतलब and we have specialists. I'm so proud that in India we have people like Pankaj Surend who can guide you. That's really important, because there's a lot of stages, and I feel that if we come to an early stage to you, then obviously some basic therapies will help it out.
Sure.
So, Dr. Saab, what are the one should follow the rules, that help the people to avoid these kind of problems, first, because cure is always there with you. But what will be the
prevention?
Yes, yes.
Prevention. So see. Again, with this in this era of knowledge, especially the WhatsApp knowledge, right? WhatsApp University we have, right? We
and Google also.
And Google also. Now we have ChatGPT also, right? It can give you everything. So with that kind of knowledge, yes, definitely everybody knows what we are supposed to do, but we don't follow that, right? So we just have to follow that. Suppose. And a lot of times we get a patient and we tell them, see, you don't require anything, you just require some physical activity. That is what you need. And especially after this COVID and this work from home culture which has happened, it is actually destroying our generation.
I know.
Right?
Work from home and this laptop and
yes,
I think going out has
yeah.
reduced. Yes.
So physical activity is what is required for your joints. Simple thing, what is important to understand. It's not very technical. All your joints, the entire spine, it is the nutrition of the joints in the spine. It all depends on your movements.
Okay.
Simple. If you are not moving, they will not get a nutrition. They do not have their own blood supply. It is only possible if you are putting a compression decompression forces. So This was possible only if you are moving. So that is why you always suggest simple things. Okay, you are busy, everybody is busy, you don't get time, at least take out 30 minutes for yourself. Morning, evening, that's it. I give very good example to my patients. You are working from home. Earlier we are going to office, right?
Yes.
ऑफिस जाते थे कितना टाइम लगता था? सब 1-1.5 घंटा लगता था एक साइड में।
हाँ।
अब 3 घंटे आप आना जाना करते थे ना?
हाँ।
बच गया ना टाइम तुम्हारा?
हाँ, बच गया।
अब आप घर से काम कर रहे हो, तो वो जो 3 घंटे में से 1 घंटा आप निकाल लो। That was total waste.
सही बात है।
वो तो रोड पे वेस्ट करते थे ना आप, तो बचिए ना आपका 3 घंटे टाइम।
ऐसे वही होता है ना, जब हमें प्रॉब्लम ना तंग करना शुरू करती है ना, अलार्म, तब हम डॉक्टर पर भागते हैं, या तब हम सोचते हैं अरे यार पेन ना अब सहा नहीं जा रहा है। वो आई थिंक हर एक के साथ है, मतलब
that is true. That is most of our I'll say Indian population especially.
अच्छा,
yes.
Okay.
It is not there in other countries. I'm telling you, this is very fact. They take their pain very seriously from the very beginning. But everybody understands that pain is a signal. इस पेन हो रहा है मतलब कुछ रीजन है, ऐसे ही नहीं हो रहा, कोई रीजन होगा उसके पीछे, राइट? तभी हो रहा है आपको. So this is the time, best time to reverse it. It should not go to the right direction.
फेथ वाली बात है कि डॉक्टर पे ना, you feel that मैं जाऊंगा तो डॉक्टर साहब मतलब वो you will not add
सर्जरी कर देंगे.
जैसे आपने बोला कि वो मिथ है, तो
ऐसा नहीं होता. नॉर्मली ऐसा नहीं होता. 99% ऐसा नहीं होता. यस, अच्छे लोग बुरे लोग सब जगह होते हैं. वी नो दैट, राइट? But most of the doctors are not like that. Wherever it is required, yes, definitely we advise them for surgery, and that is our concept of IPSC.
Okay.
Any patient coming to us, we are not forcing anybody for surgery. We are not forcing anybody for the medications. What is best for you, we only suggest that.
That's nice.
Because we have all the facilities. It's not that I'm doing only surgery, so I only advise surgery. It's not that. Even if the patient doesn't require surgery, I will not suggest the patient surgery. Yes, at times this happens. Patient come to us कि ना हमको सर्जरी बना है, हमको यहाँ पे सर्जरी करवानी है.
I got your point. आप बोलते हैं जरूरत ही नहीं है.
हम बोलते हैं नहीं है आपको जरूरत. आपको हम इतने छोटे से कर सकते हैं. So let's go for this technique first. Right? So
because there's a huge population, everybody's facing some other point of वो एक genuine एक चीज अब हम feedback देंगे तो obviously people will benefit and obviously more people will join. Because वो एक faith वगैरह ना, faith एक spread होना बहुत जरूरी है. Then the right things.
डॉक्टर के ऊपर faith तो definitely yes, what you are saying is also right कि ना थोड़ा सा कुछ हुआ है जो कुछ corporates ने इस तरह की जो करते हैं कि ना ज़्यादा प्रेशर राइज करते हैं डॉक्टर्स को to do the surgeries, to write the test.
But I'm very happy that you have started this institute, and I've really heard a lot about it. That makes me come to you and ask you to just connect to COMI family and any message you want to give or any other piece of information you want to give to our family.
So I would say that especially for the younger population, that give yourself some time. अपने time निकालिए. Maybe 30 minutes morning, evening, that is sufficient. Don't sit for more than 30 to 40 minutes. That is the best thing. Simple things. You can do simple things. A lot of time people come and they say, okay, I'm going to start tomorrow, I'm going to start gym. Don't do that. Right? If you're not doing habitual to the gymming, don't suddenly go to the gym. You have simple techniques. You have simple things which you can do, and take the pain seriously. If the pain is there, you treat it early before it goes into the degenerative process and becomes irreversible. So it is very important for all of us to understand that pain is a signal. It is giving us some indication that something is happening wrong. Prevent it there only. We can reverse it that time only. And there are so many technologies which are available nowadays. Take advantage of those technologies. Every pain doesn't require surgery. We can do a lot of interventions. We can do a lot of minimal injury techniques where we can prevent and we can treat this pain.
Wow,
Thank you.
That's really nice. I'm taking a lot of positive message for every one of us. So we don't have to wait to, pain to go to a next level where, as the doctor says, irreversible. So, if you're feeling any kind of pain in your body, just speak to your specialist. Dr. Pankaj is here also. And how to reach to you, Dr. Pankaj?
Yeah, so we have this website is there, IPSCindia.com. That is there, and we have online consultations available. You can book your online consultation also, and we have on the website everything is available, so you can reach to us anytime.
Thank you, COMI family, and I think it's an alarm for all of us to take care of our health, eat healthy, and also you have to take care of your physical activity, because sitting on the laptop, which I also do, and I also facing this neck strain, which also alarming for me, because this is for me also, but it's not for you only. For I also have to follow it, because many of you know that I'm also facing it regularly, because sitting on my laptop and working on my phone is my day and night activity, and many of you have been facing the same. So as I'll be just connecting with him soon for my treatment, but I think let's not reach to that stage. Just go for some activity and stay happy and keep walking and enjoying your life. Stay connected. Thank you, and let's connect soon for the next talk show with another specialist. Thank you, Dr. Suran.
Thank you
so much for be starting this hospital in India for all of us. This is what the pain therapy, pain specialist is here, and we are really proud of you.
Thank you, ma'am.
Thank you so much.